The AML18 trial is a trial that I've been involved with for a number of years as co-chief investigator, and it's one of the latest in a succession of mass participation studies that we run at upwards of 80 trial sites around the UK, but also in some partner countries as well. And AML18 is looking at a number of different interventions for patients who are over the age of 60 but are fit and felt to be suitable to receive intensive treatment. And AML18 has looked at a number of things. It's going to be running for 5 years. It's coming towards the end of that period now. None of the results are currently available to report on, but we're expecting some exciting data in the next 2 years or so. AML18's looked at the addition of 1 or 2 doses of myelotarg to the induction schedule for these patients. Perhaps the most exciting intervention, it's one of the first trials which has looked at interventions based on the presence or absence of minimal residual disease following the first cycle of chemotherapy. So LaboraFuture, which has been spearheaded by Sylvie Freeman working in Birmingham, we identify a patient sort of bespoke immunophenotype which defines their disease, and then look to see if those cells are still present on recovery from the first cycle of chemotherapy. We know that patients from previous studies that still have detectable disease by that method stand to do worse if they carry on with their standard treatment. And so we're looking at a number of different randomized interventions following cycle 2 onwards, particularly with slightly intensified chemotherapy with FLAG-IDA or the addition of cladribine, to see if we can improve the outlook for those patients. The trials also looked at some more targeted approaches, like the addition of the small molecule inhibitor quizartinib as well. So these are a number of interventions which we expect to have some steer as to how effective they've been in the next 2 years or so. AML18, it feeds into our sort of national philosophy of large participation studies which we run from one generation to the next. So they tend to go through 5-year cycles, and the next successor study builds on the successes of the previous one. So the National Trials Group is currently in the early stages of starting to plan for the next sequence of studies, which will, again, in the context of AML18, it will primarily be for patients who are newly diagnosed and fit for intensive treatment. And the trial of the next generation of studies is currently under discussion, but it will build on the successes of the previous generation.